So a lot of folks who are struggling with a chronic condition of one form or another are going to, at some point along their path, find through their own research, through the advice of a friend, or maybe even a medical professional, that yeast overgrowth can play a substantial role in how they do, health-wise or illness-wise. And this can look a lot of different ways. You know, sometimes people have obvious fungal infections on the skin, in the groin, on the feet. Sometimes it's, you know, something like thrush in the mouth. And it can come about from poor diet, from living in a cold, damp, moldy environment, from overuse or improper use of antibiotics. And one of the pieces of advice that's commonly given in dietary therapy to treat this is to avoid eating mushrooms. I don't know where this came from. I suspect it has to do with the fact that mushrooms, either culinary or therapeutic, are high in what's called polysaccharides. And you know, that's Latin for many sugars, and literally translated like that and taken out of context, you might think that, yeah, okay, many sugars, yeast, mold, etc., this stuff thrives on sugar, I gotta keep that out of my body. It's true you wanna avoid eating refined sugars, even some grains, too many starches in general, carbohydrates of all kinds can affect yeast overgrowth. But the mushrooms themselves, these guys largely work in your favor. So the polysaccharides that are present in mushrooms are actually medicinal. These are the components of the medicinal mushrooms you hear about all the time, like the reishi, the oyster, the lion's mane, the turkey tail. These are the ones that actually have the anti-cancer effects, that have the effects on boosting the efficacy and the power and the awareness of your immune system to take care of invaders, of cells that are mutated or gone awry. Those polysaccharides don't feed yeast overgrowth, at least not in the amounts that any sane human would consume them for part of their diet or part of their medicine. You shouldn't eat raw mushrooms. And if you're only eating things from the grocery store, like those little buttons, you know, those are fine. They're not wrong, especially if you cook them well, but you want to get a diverse amount of mushrooms in your diet. You want to eat different kinds. So all the ones I just mentioned, they don't necessarily taste great. They are medicinal mushrooms. They're not necessarily culinary, but you can throw them in your soup. Like if you're boiling up a big pot of bone broth, you're putting in some vegetables in there, throw in a handful of medicinal mushrooms. Your family won't notice, no one will complain, but they all get the health effects. If you're cooking mushrooms to eat dietarily, and that can be those buttons, you know, chanterelles, crimenes, portobellos, oysters, you know, a lot of different kinds, whether you wild forage them in the woods, or you, please do that safely if you do it, or you buy them at the grocery store, you want to cook them, and they're really well consumed with warming spices. So in many traditional cultures, in many traditional diets where people are eating mushrooms regularly, they will serve them as part of a standard meal in like a cold, damp, mold-ridden place, because it's known that these mushrooms help eliminate that stuff from the body. They will use them medicinally. If somebody is suffering from some kind of fungal infection or dietary condition that has to do with yeast overgrowth, very often they will be prescribed meals of cooked mushrooms. And those mushrooms are always cooked with warming spices. So black pepper, cayenne pepper, you can use just a pinch, you don't have to burn your mouth. Sichuan peppercorns are especially good in this respect. Ginger, garlic. My favorite way to cook mushrooms is dice them up, throw them in a pan, saute them lightly with a little bit of thyme, garlic, salt, black pepper. They're delicious and they're so good for you. So when dealing with pathological yeast overgrowth, there are a lot of valid, common dietary recommendations out there on the internet. Avoiding mushrooms is not one of them.